Good evening, Danvers. My name is Mark Zubarek, and welcome to the Topics of the Town News, July 30th, 2020 version. I have two co-hosts with me today. I have Matthew Duggan, and I also have a special guest, Jim Morose. John Toomey, currently unavailable due to being cautious about his health, and he has been sitting outside looking in, so he criticizes our show all the time. Transparency and independent reporting is our motto. The Topics of the Town News reporting is by Danvers producers for Danvers residents. We always report the truth based on events in our town. Sometimes we do have our own opinions, so be patient. Now we have the town seal that is very evident in Town Hall, and it's called the King Unwilling Danvers Town Seal. The Constitution and the town seal represent our form of government. The Constitution is a restraint on the government. It tells the government what it can or cannot do. It does not tell the people what we can or can't do. So we do not understand how the world was convinced that the COVID-19 virus became a pandemic of such proportions. The elderly and vulnerable are at risk, and the government actions have not taken the proper steps to prevent such individuals from this virus. Whether they rather shut down our homes, businesses, and town hall, 65% of the Massachusetts deaths are related to nursing homes and assisted living facilities. Why the Soldiers' Home did have so many fatalities? It was abandoned by the state government. They didn't follow their own regulations. Now we get into our show and presentation of the news stories. Our Topics of the Town news production will consist of 4 segments today. And the first segment, the news story number 1, is Declaration of Emergency and the Conduct of Danvers Boards, especially the Board of Selectmen, and why this was an emergency and how it was implemented to flatten the curve and the cutting of all of the infections. Well, there's another side of the emergency. And Jim, could you go into the lessons of government's ugly intrusion into America's healthcare must not be forgotten?
Very good, I will. Okay, and that is the title of an article written by Andy Biggs. He wrote that Wednesday, June 3rd. It was posted on the web, and we forgot to write down where it came from. But Andy Biggs, Lessons of Government, June 3rd. Analysis and opinion. Here it goes. Right from Andy Biggs. We have seen up close and personal what scarcity of medical services look like, and in effect, what a government takeover of America's healthcare looks like, and it's ugly. Here's a way to think about it. When we first saw COVID-19 arriving in America, we already knew that there were demographic groups more vulnerable than others. In particular, the elderly were at risk, and then the balance of the population. Those who had serious medical conditions fit that same category. If you were aged and infirm, you were in the highest risk zone. In a centralized fashion, government began running the medical care system. Of course, government can always be trusted to run everything it does in a perfect way. Perfectly awful, usually. And this was not any different. Many voices now acknowledge that a surge never came. Some say that the surge failed to materialize because of the lockdowns. Others argue that the surge was never going to come. When the surge came, Government officials and their guidelines failed to recognize what was seemingly obvious. The surge was in the nursing homes, assisted living facilities, and the congregate care environments that house the most vulnerable and infirm population, the sick and the elderly. Hospitals refused admittance or transferred elderly patients, including those with the coronavirus, back to nursing homes. Turns out the majority of COVID-19 patients and those who perished in deaths related to the virus were in those facilities. The surge was the nursing home residents. If there had not been government interference into the decision-making of the highly trained hospital administrators, those patients would have been properly treated and cared for at hospitals where equipment is available. Their trained professionals are working and where the patients had a better chance of survival. By determining that hospitals could only take emergency patients in COVID-19 cases, governors rationed health care. I got to turn the page here, people. Elective surgery isn't a cosmetically desired nose job. It is defined as a scheduled surgery. It is estimated that 80% of elective surgeries were missed because of government edict. They wanted to be able to make the determination of whether they had the capacity to perform elective surgeries and still be prepared for a potential surge of virus patients. In other words, the solution was to resort to market-based decisions made by people who are experts and have skin in the game, not by government bureaucrats and officials who have limited knowledge and nothing personally to lose if they enforce a lousy policy. Medicaid for all, or Medicare for all, and other broad attempts to centralize and nationalize healthcare will create the scarcity and rationing that prevent treatment necessary to preserve lives. The lesson from government intrusion into the handling of coronavirus cannot be forgotten. Market-based decisions save lives. Now, here's a little commentary from the Topics of the Town editorial staff on that, which goes, "This is how our government took over our lives and continues to exercise control over business, industry, and our personal freedom. They created a fear factor to our population and succeeded by scaring the general population with death if we did not succumb to their mandates. And now they have the upper hand. We must resist and regain our freedoms. Government must get out of the fear-mongering business and stop fear-mongering our population into submission." That's the end of the story.
Thank you, Jim. That was a article and information that's been gathered by many different outlets, and it's really delivers the message about our own healthcare system in this country and in this state. We are unprepared. We only do the high-cost operations or like they said in the article, nose jobs. The thing is that we forgot about our elderly and our soldiers at the veterans at the home, soldiers' home in Holyoke. There, the governor did not take proper action to get moving and get those people released into separate rooms. And they had the facilities. They just didn't know what to do. So
I would like to further talk about that because they like the article said, they rationed healthcare and they said they couldn't do all these things. History is not going to be kind to the governors like Governor Cuomo, who actually cried that he didn't have enough hospitals and enough space, so the Fed sent in ships and all sorts of medical people and supplies and cleaned out all sorts of buildings so that they could, and they sent the people. Cuomo personally demanded that those sick people go back to the institutions when he should have sent them to the ships in the spaces he was crying about. But the news won't report it. Nothing gets reported. So if they don't report it, it doesn't happen. He's a beautiful guy. He's great. But, 20 years from now, when they finally write the history, he's got blood on his hands.
That's right. And the problem is, and going back to the state of Massachusetts and our dictator governor, 65% of the fatalities or the deaths in this reported coronavirus situation are from nursing homes. And the thing is that we seem to forget that, and the governor is taking victory laps now because he was not able to save those veterans and at the soldiers' home. Matthew, what do you have to say about this? Put your mic on.
About the article?
Yes.
Well, I see that the author is a U.S. representative from Arizona who's a Trumper. I think he's a believer that the virus is a hoax, and that he's in camp with Trump. They want more concern with Trump's reelection than they are with safely open schools. So I think this is a biased viewpoint. And while it may be that nursing homes do see a higher rate of deaths, I think now you see it across the board. So that was in initial stages back in March and April, but now I think you're seeing younger people being impacted as well. So it's spread so much into the general population that I don't know if there's any certain demographic that you can identify as being more impacted than others.
Well, if you look at the statistics for the state of Massachusetts, 65% of the fatalities were related directly to nursing homes and assisted living facilities. So, and they were in the age level of between, I think, 78 to 84. So the thing is...
Okay, wait a minute. There's a huge difference between the infection rate and the mortality rate. See, there's 65% of the people that were mortally injured by this with 65% in the nursing home. Right now, the infection rate is going amongst all the younger people, but they're not dying. The death rate is still, less than 1%.
Yeah, the infection rate currently is at 1.7%. So
yeah, you can get infected and still even survive, but still experience long-term repercussions in terms of health issues. Your lungs are damaged. They have blood clots throughout your body. But just back to the nursing homes, nursing homes in general are profit-driven centers where the staff is usually low-paid individuals. We know here in Danvers that there's at least one or two nursing homes that have been reprimanded by the state for poor care. So it doesn't surprise us that if there you have a large concentration of vulnerable people and you have poor protections in place, not enough PPE, you have people just being packed together, I think that's ripe for high rates of death and infections.
All right, thank you, Matthew, and thank you, Jim. I have the story number 2 is a letter to the editor that I've been writing for the last 2 months, and
over and
over again, and which was not published due to lack of space, I believe. So I'm going to give you a short version of what I believe is the issue, and this is opinion, and you have to consider that, but there's a lot of facts in here as well. one of the comments that I made, and I did that last show, is I am so tired of the media using the phrase, "We are in this together." That becoming the song of the news media and the newspapers and every commentator. We are not together. The government has asked us to break family ties, group gatherings, and social person-to-person contact. The media, with the help of our health experts, has frightened our children, friends, and relatives to a point of the fear of catching the virus and killing our parents and grandparents. The governor banned large group gatherings for the fear of an uprising or a rebellion to the edicts. The state Supreme Court made gun shops essential to our protection. The state government knows that it is in danger of an uprising. There is more to this story. We have not asked for this epidemic, and we do not want the elites to run our lives. We need personal freedom, and let it be our responsibility for our health and businesses. The government needs to get out of the way and stop being our protector. We will not die from this virus, but we are in danger of being left to die by neglect. We need to recapture our family unit and take care of our elderly at our nursing home depositories. And I call them depositories for a reason. And just for clarity, I don't know about Matthew or Jim, but I'm in the zone where I'm susceptible as well. Our elderly are at risk and must be taken care of. By not being sent to our rooms by the regulations of our socialist government, the government needs to refocus their activities to governing and not on terrorizing a population. Need to have the government protect the population instead of dictating social engineered rules and regulations. The restriction and quarantines that have been imposed by our governor, and I call him a dictator, and the town manager, who's really the mini dictator because he sent out the same edict that the governor did. These regulations are voluntary. There is no legal basis. Our residents and taxpayers are voluntarily obedient to our authorities, dictators, who are telling us to abandon our liberties and religious freedom and our commitments to our own freedom. We have to ask why our jobs are not essential, but our elected and appointed government elites are essential. All local, state, and federal jobs are safe and being funded by taxpayers, like you and me. Where is the leadership of our elite elected and appointed officials? When will they reduce or eliminate their salaries to support their dictates? Business is on the ropes, and our leaders are asleep at the switch. The selectmen have authority of home rule and can remove the governor's edicts or not comply with it, but they are asleep at the switch. Home rule can be implemented. Some towns, through their select boards, have basically ignored the governor's rules and regulations regarding certain gatherings. And recently, we as a town had a town meeting in person where Pat Frazier made sure that that happened, and it was successful. Nobody got hurt. Nobody got the virus. All across the country, Americans have had enough of the coronavirus lockdown. They're ready to get back to work, and they're calling on their misguided state governors to get out of the way and govern according to their elected responsibilities and not by edicts. Clear the paths to restarting our local economies and stay out of personal responsibilities. We don't need another big brother or a governor mother. Legal actions are being filed against the governor and the dictatorial town managers and mayors. All actions are illegal and unconstitutional. We need to hold back our real estate taxes. On August 3rd, we are due for a tax payment on Monday. We need to hold back our tax payments to starve the funding of local mismanagement of some of our services. Our education facilities and teachers are non-existent. Our portion of the real estate taxes must be reduced and payments withheld because of the lack of real education of our future residents. Real estate taxes are due on August 3rd. 50% of your payment that goes into the town coffers is slated for education. And basically, education has been shut down since March 13th, I believe. So that's my version of what I believe. And Matthew, you have anything? Matthew, you have to get your mic.
Yeah, I don't know if it's, I would classify it as dictatorial, being a dictatorship type of control over us. I think that they may have overreacted, and at this point, there's no clear indication about when these restrictions are going to be lifted, especially with the town hall. Trying to contact people in the town hall is a real struggle for some of my neighbors.
Well, the problem is who are these people working for? They're working for you and me. We're paying their bills. And now they're hiding behind the governor's edicts, and it's maybe not dictatorial, but it's authoritarian. Is that correct? I don't know if that's correct or not. But I believe that, and as I said last show 2 weeks ago, I wanted to send out a group of people to go and demonstrate in front of town hall with signs saying, open up or release me, because that is something that we need and we are paying for it. And the governor is imposing more and more rules, and he's listening to the mayor of Boston, Walsh. And Walsh is afraid of his shadow. So we need to recapture our civil liberties and constitutional freedoms. So, Jim, you got anything?
You know, that phrase, like you said, we're all in this together. Yeah, we may be in the same storm, but as someone posted on the website there, it said, yeah, we may be in the same storm, but some of us are in yachts, some of us are in little, cabin cruisers, some of us are in rowboats, and some of us are just clinging on to driftwood for dear life. Okay, and the ivory tower release, like you said, they can just make all these edicts, but are they really taking into consideration the people who have to work and they're the typical middle class families that work, paycheck to paycheck, and they got a little, but after 4 months, there's no buffer left. How are they going to pay that? People are getting thrown out in the street. People have not even gone to the doctors or anything. But it's okay. That's okay, because they know better than us.
That's right. And we have to stop that because it has gone out of control. So we get into story number 3, and we're doing well on time. I like this. Town manager's declaration of emergency and the conduct of public meetings. And this basically, what I'd like to do is maybe have Matthew give us a summary of what has transpired in your attempt to get open meetings. So if you would give us a little rundown, and then we'll go into the other items that I have on here.
Sure. So just kind of just a refresher on where we stand today. So in the beginning of the lockdown in middle of March and into April and May, there really were no meetings held whatsoever. It was only, it seems, in June that they started to ramp up, and they were remote meetings via the WebEx. So kind of a learning experience for everyone, even though most people, well, not most, but there's a lot of people that use that type of interface at work, either Skype calls or Zoom, WebEx. So we should be familiar with how it works. But for Danvers, and maybe some other communities, but specifically for Danvers, they restricted the participation of these online meetings, especially I'm referring to public hearings, where people had applications that they were presenting. They either were looking for variances or some kind of relief to projects. So this would be Conservation Commission, Planning Board. And I use those two as examples because even today they still have these restrictions where the public is only allowed to interact by email or by phone calls to an intermediary. They don't get that same level of interaction that the applicant does. The applicant would perhaps have a lawyer, and so they're having this two-way conversation between the board and the person that's looking for this relief. And meanwhile, the public is just kind of just on the sidelines watching this unfold and not being an active participant. So for me personally, that became frustrating after several weeks. And so I filed an open meeting complaint saying that this interpretation of the governor's orders really the governor was, I think, trying to just allow remote meetings to occur because previously that wasn't the case. I don't think the governor was saying, oh, and by the way, the public could just be not fully involved. So,
well, I think
go ahead.
The governor himself has issued his edict, and he tried to solve the problem, but I don't think he understands what the problem is. And the thing is that you filed a open meeting. What is it? A violation?
Open meeting. Well, it's a complaint. So open meeting law complaint.
This is the same thing that I did when I was dealing with the Beverly Airport. And the complaint went directly to the chairman of the board for the Beverly Airport. And he answered the complaint. And in this case, what I listened to the discussions that they've had regarding your complaint is that they were poo-pooing it away, that it's just a complaint, it's not a violation, and it is a violation. And the thing is, the town hall is going to be responding to your complaint, and the thing is, it has to go to the Attorney General because that's where the decision point is, because it's right now, it's the meetings are being held under duress, basically because they claim that the governor's edict is what's controlling it. And that's not what it is. It's open meeting. That's what we have, and that's what we should be getting. Right. So the next step, Matthew, what do you think is the next step?
Well, I'm waiting to get a response back from staff or from the. In this case, I'm specific to the planning board because I also have one against the Conservation Commission. I'm required to receive a written response back from them probably within 5 or 10 business days because they've already gone through the process of discussing it. And then if I don't agree or accept their response, then I can go to step 2, which is sending the material and my reasons why to there's a department underneath the Attorney General that handles these types of cases. And so if the board is found at fault, they'll need to, adjust how they run the meetings, and they'll may also have to attend some type of, training to explain to them how this process works. But I think it's undemocratic to just arbitrarily block the public from participating, and I don't understand why there aren't more people speaking up about this. I filed the complaint only because I wasn't getting any traction from anybody. People, like you say, they just kind of dismissed it as I was just, not being reasonable. I should just accept it the way it is because that's the way it is. But you have to draw the line somewhere.
Even during good times when you have access, there's very little involvement from the public. And now it's even less because everybody seems to be happy on unemployment with the extra $600 a week, and they're happy in their bunkers, just like the selectmen. The selectmen are sitting at their home, and I don't know what they're doing. I'm wondering, where is our government? Our government is not there. The selectmen should be dictating this instead of regular citizens demanding to have access to these meetings.
Well, I was told by the selectmen that that it wasn't their responsibility.
Oh, they're the highest elected office in our town, and they don't have anything else to do. So
I would just like to urge anyone and everyone who's watching this show right now. You heard what Matt said. You know what he's done. It'll be in the paper eventually. But if you go to danverstv.org and just scoop around somewhere, you'll actually find the planning board meeting they had at like 12 o'clock in the afternoon on Tuesday. It goes for about 54 minutes. And listen to how they discuss the issue that Matt brought up about the public hearings. So don't take our word for it. I think, you watch that meeting, and if you got issues or questions after watching that, yeah, we all should have plenty of time. We're stuck in a house, can't do anything. What's everyone doing? I mean, yeah, I gotta fix my gutters and my fences, but yeah, we gotta. Yeah. We can take a little extra time to find out what's going on. danverstv.org. Find the planning board meeting of July 28th at 12 o'clock.
All right. Thank you, Jim. The follow-up to this is really, I have written this out, and I'm going to present it because this is very serious business, because we are endangered as residents of this country, of this state, of this town, because I have seen what socialism and communism does. I've lived it when I was a kid, but I lived it. I understand it. But let me just go through a few items here. I really want to get these across, and we have plenty of time today. All house arrests and quarantines are imposed by our governor and town manager as voluntary, and we are voluntarily obedient to our elected dictators who are asking us that we abandon our liberties and religious commitments. We are dictated to stay in hiding in our bunkers without a means of earning a living and feeding our families. We are held hostage in our own homes with no end in sight. The sad part about this statement is that we are becoming sheep. We are folding our tent and saying, okay, Governor, this is the way it is. Nobody's objecting to this because they're scared the heck out of our children, our friends, and our younger individuals, because they are so afraid of getting the virus to the elderly. Well, I'm not afraid of the virus. The thing is, we are not being threatened We are now being threatened with legislative action by the State House to legislate the wearing of masks. This legalization will commit us to wear the mask as a symbol of submission to our elected officials and will include a $100 fine if we are caught without a mask. Who the heck is going to impose this fine? Who's going to give you a ticket? All of this is voluntary. None of the legislators have voted for this. Where are our legislators? Our senator, lovely, is in Salem, and our Ted Speliotis is locked up in his house. But they can go and do all kinds of things at the State House about the police, about the masks. What the heck is going on? The state is also passing laws regarding how we control our police and actions on their part. The immunity that our officers, nurses, and other municipal employees enjoy will be eliminated. How can they do their job and be liable for their assigned activities? Their jobs are now defined as essential. Jim, you have anything on that?
Well, there's a lot of things I could say, but basically, man, how can you pass a law and then expect people to just jump through all these hoops? I mean, the thing is, the actual, we were supposed to be flattening the curve, and the curve's been flattened, but yet they're increasing all these restrictions. They're building up restrictions while the science and the facts say go the other way. And infections mean nothing about the fact that of the mortality rate. I think what I heard probably the beginning of the week was COVID-19 has about either 3.6 million or 36 million fatalities to catch up to H1N1. Okay, that's how you got to look at these things in perspective. Okay, you just can't look at this one thing and don't look at anything else. You look at these things in perspective, and you will see that this is, there's always going to be residual, as Matt said. Even if you don't die, you're going to get. Well, we're all going to get sick. We're all going to die eventually. But do we shut down the whole country for that amount of people? That's the question.
Well,
and again, history is not going to be kind to the media and to the leaders who did this to America.
That's right. Matthew?
I think we're in the eye of a hurricane, so it sounds like overreaction. Even now, we're like 5 months into this, so I think the masks, the separation, physical distancing, it seems to be working here in Massachusetts. We see right now what's happening in down south, where they didn't follow these restrictive guidelines. They opened up too soon, and they're paying the price now. So I would hate to have that reoccur here, and that's a fear for everyone.
Not being a doctor and not being a politician, I believe that what is happening down south is that the testing has intensified because they wanted to test more people. So now they're getting more individuals infected with the virus. And I don't want to call it a disease because it's a virus. And what they're doing is they're counting everyone under the sun, whoever comes in for a test, that they have the COVID-19 virus. It's for a purpose. And the purpose is not evident to everyone. And the purpose is to succumb and submit the population to their wishes. And that's what they want to do. So
it's to instill fear. And you're right. Those numbers, specifically in Florida, there was a whole article about that where they wrote, everyone that came in, they gave, 5,000 people came in and got tested. 5,000 people ended up with the coronavirus. But that's well, we made a mistake. We put the wrong numbers in the wrong column, man.
Yeah.
And that's it wasn't just one place, it was all over the place. The numbers, why is this such an important, again,
This whole situation is affecting every single one of us, whether it's the virus or our financial position or our relations with people and family. So I inquired about the legality of any actions taken by the town manager in support of the illegal and unconstitutional actions by our governor. No response from my invitation. They like it that way. Press is banned from town hall. I went to the health director or health inspector or whatever you want to call him, and I had no response. He wouldn't call me back. The town manager doesn't want anybody in town hall, doesn't want to talk to anyone. I went to the police chief to ask about his impressions of what does he or is he required to monitor and how many tickets has he issued to people. And it doesn't seem to have any effect. They don't want to hear from anyone asking those kinds of questions. The town has a moratorium on information to our residents. Nothing gets reported unless it is planted by the town manager to the papers and other media. And now I understand the policy that was issued to the municipal light board when I was attending those meetings. There's a whole page of not to-dos by the directors or their facility managers and the town manager as well. Everything is supposed to be passed through the town hall. None of the chairman of the committees or municipal light board director is not permitted to speak to the press, especially to the press. So now we know the rest of the story. Jim?
Yeah, you're right. I mean, see, because you focus on the Danvers end of it. I mean, what's happening real time right now is the squelching of information. So this week, hundreds, if not thousands, of doctors came out and said that they have patients in their care that they've been given. Okay, what is the hydrochloroquine drug, and they've been having a huge success rate if you catch it early. But apparently, the fake news will tell you that hydrochloroquine doesn't work because they use tests where people got the drug 3 or 4 weeks after they had the disease. It was too late. So, but if you get it early, it works. It's a preventive measure. But even if you have it within the first 2 weeks, it will cure you. And the reports also say that they think that a lot of, like the president and a lot of people are taking hydrochloroquine as a preventive measure. They're not getting it, and they don't really care. And so, but the high-tech Facebook, Twitter, and all these people are suppressing, they're suppressing all this information. They're taking it off. They put out websites. And this happened months ago when the other 2 doctors from California had a whole report, and it got squashed because fake news is fake news. It's real. The fake news is real. And it's an agenda to scare the bejesus out of everyone. And they've done a good job of it. They've really done it. It's the rules of the radicals. Rules for radicals, and they've done it. And people are going to have to wake up because otherwise it's going to be too late. Because that's how socialism works. That's how they scare you into submission.
They did it to the world, so I give them congratulations, but this thing is going way out of control. My next item on here is that court actions are also delayed or in collusion with the legislators. All legal cases are not being heard because our courts are also in their bunkers. How convenient. So there are legal cases that have been filed, against the governor and against the managers and mayors and everything else, but they're being held on somebody's desk who's not even there. I have one confession to make, and is I made an appeal last show 2 weeks ago that we have a demonstration in front of town hall. Release me, open the town hall. And I had a sign made up and everything else, and I almost went by myself. But our suggested appeal to organize a demonstration at town hall and demand our rights from our elected officials, the resident police, nurses, and other municipal employees are afraid to show their hand. But we are residents, and taxpayers are able and must stand our ground and demand an end to this police state. The fear of reprisal from town hall and the governor's office has limited our appeal, and only a few residents wanted to come in person. Many people were willing to express their views, but not at a public demonstration. So this is a continuation of our original statements months ago that people do not want to be identified and express their views. And Matthew, you're one example of people that are willing to stand up and be counted. So that's my story about the restraints and the town manager and town selectman control. So, Matthew, you have anything on that?
Again, I think we're kind of in the eye of the hurricane right now, where things seem like they're returning to normal. The first wave of the storm has passed us by, and now the sun has reappeared. But I think we all know that the back end of the hurricane is the one that's the most dangerous. And what's coming now, I think tomorrow, is the end of the increases in unemployment. So people will be impacted by having less financial resources. I know there's another stimulus package that's coming along, but those are just temporary bumps to the economic activity. They're not sustainable. And I think over the long haul, later this year and into next year, we're really going to see the true impact of what we're living through right now. So, right. And I don't think we're really prepared for it. We're kind of in a state of denial where we want everything to open back up. We all want, schools to reopen. We want to go back to work. And that's a normal thing to want to do, but.
Well, you're right, Matt. But you can't have it both ways. You can't say, we can't go back to send the kids back to school. But why are we still paying the teachers for the last 5-6 months? And do we need to carry that weight? Why is it that the private sector and the people have to get laid off, like you just said? They're laid off. They're unemployed. They don't have enough money. Then what's going to happen? And yet the state, they want their taxes. Now they're going to go out and find more places to find taxes. We just had a town meeting. And they jacked it up, and they want us to pay, but they're not cutting. They didn't even open up the drawer with the knife in it, like I said last time. But right. To get back to your point, Mark, because you did say we have a little extra time, I just want to say there's the Danvers website, danvers.mass.ma. They have a whole Facebook webpage. I think there's over 7,000 people on it. So I took a poll. I said, should town hall be open or closed? And it was just, open, yes, closed, no. And 128 people said town hall should be open. 7 people said it should stay closed. And 15 people said they have no opinion. Okay, which I thought was really funny. We have more people with no opinion than say no. But we have 128 people that think it should be open. Again, it goes back to the fact that we're all in the same storm, but everyone has a different boat, and some people are holding on to driftwood for dear life.
Well, the thing that I'm concerned about is that Matthew, you brought up the point about the unemployment and the $600 a week. We are becoming a welfare state. We have our population dependent on federal government grants, basically.
We can't even afford it because we're already $23 trillion in debt, and these darn bailout packages are $3 trillion here, $4 trillion there. We're going to be up to $30 trillion before you know it. Who's going to pay that? China wants their money.
That's
They're
right.
like Mr. Crab. They want me money. Give me my money. Someone's got to pay them.
It's just paper. It's just paper.
It's just paper. That who's going to pay for it? You think? Who
I don't know,
It's
your kids,
just
my
paper
kids,
unless they owe
my
it to you.
grandchildren. The
It's
future
gonna be-
generations will pay,
Our
and they'll be
children.
happy to do it.
Our
Okay, that's
children
right. And they're not
will-
going when they write the history books, it ain't going to be really pretty what they say about the people who supported all this stupidity and extra spending that we can't afford.
Well, just remember that they scared the heck out of everybody, and everybody's afraid of dying. So let's move on, because we have the last story, and it's the final one for this this semester. I shouldn't say we're not in education. This is what
Educational program.
example of what we're going to do in the future. During August, Topics of the Town News will be conducting interviews and commentary regarding candidacies of the state and federal candidates for the following offices. What we're focusing on in August is state representative for the 13th district covering Danvers, West Peabody, and parts of Middleton. And this is Ted Spiliotis' seat, which he's retiring from after, I believe, 30 years or so. And you know what? The thing is that I've called him about the police bill that they passed in the Senate and then in the House. I haven't even got a reply. So he may be retired already. So I don't know. Maybe he's retired in place. But I just want to give you a itinerary of who I'm going to be interviewing. And Matthew, you're invited, and Jim, if you like. I have already done a campaign kickoff meeting and an interview with Bob May, who is the Republican candidate for the House of Representatives in the state of Massachusetts. I will be doing Bill Bates next week. We'll have an interview that will be recorded and filmed. And then I will ask Sally Kearns if she wants to come on and have an interview. And then I also have Jason Guida, who is an independent candidate. And Chris Cohane is another one, a young guy. His father and mother used to live in my neighborhood, so we know each other. I don't know him personally, but he's also an independent candidate. So we have Bob May, a Republican candidate, Bill Bates, independent, surprisingly, Sally Kearns, Democratic candidate, Jason Guida, independent candidate, and Chris Cohane, independent candidate. So those are our marching orders for the month of August, and what we'll try and do is televise those. Every week we'll add one. And this is important because this is going to be a new representative for our area. And also I have interviewed Kevin O'Connor and John Paul Moran, who is running for federal office instead of state. So, any final comments from Jim?
Just a disclaimer that, yeah, I don't think I'll be getting involved in that because I am the chairman of the Danvers Republican Committee, so I'll just stay away from the partisan races. But I will say that the Danvers Republican Committee will be having a outdoor meeting August 19th at the library pavilion. And, you know, we're going to have, it's a Republican committee meeting, so we invite the Republican candidates to speak. So they will come and speak. And if you want to come on down. We'll have a, you know, it'll be, we will have socially distancing and whatever, you know, the COVID-19 requirements, you know, for whatever, you know, people feel comfortable with.
Just remember, it's voluntary.
It's voluntary until they come down and charge you $500. Yep.
No, they can't do that.
I think if you have a microphone in front of you, you can take the mask off. I think
Yeah,
that's how it works.
Or when you
I'm going to give everybody a mic.
Yeah, or an ice cream cone. Matthew, how about you? You have any final comments?
Yeah, just a additional comment about your candidates. So we received a postcard in the mail recently. The November election is less than 100 days away. So people that aren't comfortable going to the polls can use this card to get both a primary ballot for September and then also the final ballot. So statistics have shown that this type of mail-in voting dramatically increases the level of participation. That it can be quite dramatic. It's been shown that states that don't allow mail-in voting oftentimes are the ones with the lowest participation. So I would just urge everyone in Danvers and throughout the state to take that postcard, mail in, get the mail. Even if you plan on going to the polls, and it's good to have the ballot in your hand in case something comes up. So I think you have several more weeks to return that.
Thank you, Matt. David Rodriguez, could you please put on my final picture of the vacancy continues? Selectmen and selectwomen asleep and hiding in their bunkers. Lack of leadership and direction of the community. They are all settled comfortably in their bunkers, protected by the governor's actions. When will this dictatorship stop? That is my final comment, because I love that picture because it shows exactly what's going on in town hall. I have seen the police and the fire on their duties. They're patrolling and they're going out to emergency calls. And we do have an excellent police department that has been well trained and accredited and does not need another influx of regulations by the government of the state of Massachusetts. We've already taken care of that. The fire department is excellent, and we need to make sure that some of this immunity issue stops. We need to call our elected officials, make sure that they do not vote for that regulation. And at this time, I'd like to announce that we will not have the two shows in August because we are going to take a summer vacation. We've been on vacation for the last year, so why not continue? So we will continue the show on September 10th, I believe, will be our next live show. And I want to thank both Jim and Matthew for contributing to this discussion, because I think it's important, and we need to make the town hall and the selectmen listen to what the heck is going on in this town. We need to get some activity and get business going again. Good night, Danvers, and goodbye for the month of August. Gentlemen.
See you in September, baby.
See you in September. There you go. That's